7 ways to fight off flu. If you become infected with the flu virus, you can be spreading germs to your family even before you know you are a carrier. And you can still be infecting your loved ones for up to a week after you first fall ill. But by practicing a few simple rules, you can help keep your family and yourself healthy and prevent the flu from spreading. Here are 7 ways you can increase your chances of all staying healthy and well. Number 1. Get vaccinated. Health experts say getting vaccinated is the single most important thing you can do to prevent catching the flu. There are now 4 main types of seasonal flu vaccine. The U.S. Centers for Disease Control and Prevention (CDC) recommends that everyone aged 6 months and older who hasn't had a previous bad reaction or doesn't have egg or mercury allergies, gets a flu vaccination. And the American Food and Drug Administration (FDA) has recommended the specific types of flu shots for the following people. A standard flu shot. This is recommended for everyone 6 months and older. An intradermal flu shot. The intradermal flu shot is administered into the skin, rather than the muscle. It uses a smaller needle and less antigen. The FDA recommends it for adults aged 18 to 64. A high-dose flu shot. Our immune system responses weaken with age. This vaccine may help improve immune response and increase prevention of the flu. A clinical trial of 31,000 older adults reported by the U.S. National Institutes of Health showed approximately 25% fewer cases of the flu in those who received the high-dose flu shot, compared to those who had the standard flu shot. A nasal spray vaccine. There is some debate over whether the nasal spray vaccine is as effective as a flu shot injection. Nevertheless, the FDA does recommend the nasal spray vaccine for people aged 2 to 49. However, no matter which of the 4 types of flu vaccine you are thinking of plumping for, if you observe certain religious or ethical dietary restrictions, you may well wish to satisfy yourself as to what exactly the ingredients are of the precise vaccine offered to you at your local clinic or pharmacy. For example, many vaccines contain substances derived from eggs, which could make them unacceptable to those who consider themselves ethical vegans or vegan for the animals. And the only flu vaccine made available by Britain's National Health Service (NHS) to schoolchildren in England in September 2020, a nasal spray containing pork gelatin, may automatically be unacceptable to Seventh-day Adventists, practicing Muslims and Orthodox Jewish families. Number 2. Cover coughs and sneezes. Flu germs are believed to spread through droplets from the mouth and nose. Use a tissue to cover your mouth and nose when you cough or sneeze. Make sure to throw the tissue away immediately and wash your hands straight away. If there's no tissue handy, cough or sneeze into the crook of your elbow. Number 3. Avoid touching your eyes, nose, and mouth. According to the CDC, flu germs can live for 2 to 8 hours on hard surfaces. That's why it's so easy to pick up flu germs without knowing it. You can get infected if you touch an infected doorknob or light switch and then rub your eyes or bite your nails. Learning to keep your hands away from your face can be tough, especially for children. Remind them often, as well as yourself. Number 4. Wash your hands often. All hand washing is not equal. For it to be effective, make sure you and your family follow these steps. Run warm water over your hands. Add soap. Scrub for at least 20 seconds. Rinse and dry. You can stock up on alcohol-based hand sanitizers for areas where sinks aren't available or when you're out and about. Store them out of the reach of young children and ensure children have adult supervision when using them. Make sure your hand sanitizers are at least 60% alcohol. And remember that they're not a replacement for washing your hands with soap and warm water. They don't tackle all germs, and don't work on visibly dirty hands. You'll need to remind kids to wash their hands each time they use the bathroom, before they eat, and after they come home from school or a play date. Number 5. Limit contact with family members who are ill. If someone in your family does get the flu, take these steps to prevent the flu from spreading. Keep the sick person at home. Limit close contact between the sick person and other family members as much as you can while they're contagious. In general, this is up to a week after they show symptoms. Change sleeping arrangements, if possible. Ideally, the sick person should be in a room on their own. You should also avoid sharing the following items with the sick person: washcloths, towels, dishes, kitchen utensils, toys. Number 6. Clean your home. Flu germs and viruses love to lurk on items you touch every day. Here are some hot spots for germs: kitchen sponges, dishcloths, chopping boards, floors, sinks, toilets, computer keyboards, mobile phones, door handles, and light switches. Clean and disinfect these hotspots regularly. You can microwave your kitchen sponge for 1 minute on a high setting to zap germs. Better yet, throw it out. If someone in your household has the flu, take special care when washing their things. Wash dishes and silverware thoroughly by hand or in the dishwasher. You don't have to do a sick person's laundry separately, but try to avoid scooping up an armload of items and holding them close before washing them. Use laundry soap, and dry on a hot setting. Always wash your hands immediately after handling dirty laundry. Number 7. Practice healthy habits. Don't forget the power of a healthy lifestyle to fight off sickness. The following tips can go far in keeping your immune system healthy, and your family well this flu season. Get plenty of sleep. Eat well, with lots of vegetables and fruits. Drink lots of fluids. Exercise regularly. Manage your stress. In conclusion, getting vaccinated is the single most important thing you can do to keep the flu from spreading. Healthy personal hygiene habits and frequent housecleaning also go a long way to help keep the flu away. If someone in your household does get the flu, keep the person at home, disinfect and clean your home well, and limit close contact with that person whenever possible. We hope you've enjoyed this video and that the information we've just given you will inspire you to stay or become healthy, happy, fit and slim. If so, please like this video and share it on your social media. And feel free to leave a comment below. Tell us what was the most useful thing you learned. And what topics would you most like us to cover in a future video? If you're new here, please subscribe to our channel, and click on the notifications bell, then the word, all, to make sure you are alerted about when our new videos are uploaded. Meanwhile, if you're still in a video viewing mood and want to watch more right now, click on our channel name below, to take you straight to our other recent videos, all of which give you news you can use to help you and your loved ones stay or even become healthy, happy, fit and slim. See you in our next video. Click on one now.